This is Dr. William O'Neill. I'm an interventional cardiologist and the director of the Center for Structural Heart Disease at Henry Ford Hospital in Detroit. Well, everyone knows that the kidneys help filter the blood and remove unwanted constituents, but what a lot of people don't understand is that the kidney is actually a very important organ for regulation of hypertension. And so the kidney will excrete hormones that cause the blood pressure to go up in times of stress. And the reason that the kidney excretes those hormones are because of nerve activities, the sympathetic nervous system running from basically the brain to the kidneys to allow the release of hormones. What recently has been established is that if those sympathetic pathways could be blocked, then blood pressure would be significantly reduced. Well, in the past, people have been trying to figure out ways of doing sympathectomy. In the 50s, surgical sympathectomy was being done in people with medically refractory hypertension, but there were a lot of side effects associated with that, specifically severe orthostatic hypotension. And so, in large part, most of those surgical attempts were abandoned. Recently, however, a variety of catheter companies have figured out ways of denervating the kidneys by going in with devices that will cause ablation of the sympathetic nervous system. And all of the catheters basically try to do the same thing. Medtronic right now I think is the leader because it has a catheter that's in their pivotal phase 3 trial. Other companies, including Boston Scientific, have other catheters. Boston has a catheter that recently received CE mark and is being used now in Europe. Initially, it's being targeted for medically refractory hypertension. I'm the chairman of the executive steering committee for the Simplicity 3 trial, which is the Medtronic trial. Dr. Deepak Bhatt and George Makris are the principal co-investigators. And this study, I think, will be the first in the U.S. large multi-center placebo-controlled randomized trial that will give us a lot of very good information. In that trial, people with refractory hypertension are being tested. That is, the patients that are on it three drugs or more and still have refractory high blood pressure. So I think that's the right initial patient population. Down the road, if this proves to be effective, there probably will be other broader applications. There's really only one good small randomized trial that has been conducted. In that study, patients with refractory hypertension were tested, and at 1 year there was a substantial reduction in both systolic and diastolic pressure. So we know that compared to active medical therapy, these devices, in particular the Medtronic device, does drop blood pressure. But that was, again, sort of a phase 1-2 trial. It was effective. It's been widely publicized, and now I think we have to have it replicated in a larger patient population. I think it's really important for all these trials that they be conducted with placebo control. Anecdotally, there have been patients that have been treated with placebo who have had significant reduction in blood pressure. And so if the patients believe that they've got some sort of therapy, they may actually have a benefit without actually any benefit. So we have to be very careful about looking down the road for well-done placebo-controlled trials. I have a concern that it's going to be kind of the Wild West out there with these catheters becoming approved. They're going to be used in sort of a haphazard way without really good science and forethought ahead of time. And we all have to be very cautious, at least in the early stages of investigation, to make sure that the therapy actually works. Yeah, the trial is a blinded, double-blind trial, so the patient doesn't know whether or not they've got treatment. The patients are heavily sedated, and then they have a sham procedure being performed. And so they really don't know whether or not they got therapy. The treating physician, the doctor in the cath lab, knows what happens, but then in follow-up, whoever's following the patient doesn't know what the patient received in treatment. So that's as good as possible for doing these sham procedures. And I think in this setting it really is important to do that because patient perception, patient adherence to medications, all of those things could be influenced by whether or not they think they had a procedure performed. And I think that this study that is currently being conducted will really answer very fundamental, important questions with a sham control. Well, it's a mechanical device, so you could potentially have vascular injury to the femoral artery when the catheter is in place. You could have damage to the renal arteries, or you could have stenosis induced by the injury that occurs with the catheter. So those are all being carefully looked at. Follow-up is going to happen 6 months and 1 year. Dopplers are going to need to be done to make sure that the renal arteries are not damaged with these devices. Again, in the early published trials, there doesn't appear to be a huge rate of complications, but we have to wait a little while until more patients are treated. Remember, in all of these medical devices, it takes 15 years before we really have a good confidence on how good the device works, what is the optimal treatment, which patients are of optimum benefit. So we all have to be really careful to not over-exuberantly promote these until we really understand how they work and who they work on. The sympathectomy is occurring at a lower level in the nervous system. It's not really in the spinal cord. And I don't think that, at least in the original published trial, that severe orthostatic hypotension was a side effect. So at least in the published studies, that hasn't been a problem, and we'll just have to wait and see with larger numbers of patients that are being treated. Well, the treatment is always contingent on reimbursement. And so they just got CE mark, Boston Scientific just got CE mark for their catheter. And usually what happens is Germany adopts these procedures first and England adopts them last, and it's just entirely related to reimbursement. So I think it's a little too early to tell whether or not what the rate of adoption is going to be, because reimbursements still are not totally set in Europe. The Medtronic trial is actively recruiting, so sometime this year they'll stop recruiting, and then there'll be a follow-up phase for about a year, and then they'll have to submit to panels. So I would guesstimate the earliest that we're going to see a panel is in 24 months. And that's just sort of a broad estimate. So the device is not really going to be available for commercial use in the United States for 3 or 4 years.